Thank you very much for the opportunity that you have given me. And first of all, I wish to share my blessings and pray for those who are affected by the COVID-19. Now, in our day-to-day life, whoever we happen to meet, they used to come out with very peculiar type of questions. They ask us whether we can cure this diseases. They will have 1,000 diseases and they want to know whether homeopathy can cure those diseases. We know that we don't go by those diseases. Still, we reserve ourselves and simply we say, yes, it is possible. So this situation sometimes creates an impression among the public to say that we also go by the way the others do and treat patients. Ultimately, in our private practice or any clinic, in our day-to-day clinics, patients used to come with diagnostic cards and various names and tell, Doctor, I would like to have some treatment for this. For a selected diseases, they don't want to disclose everything what they have, what they're suffering from. Sometimes I will have treatment for this and I will continue with other treatment for that conditions. So, considering all these issues, as a matter of to convey the public, convey the people, our approach, our fundamental way of dealing things in a most simple manner, to give an understanding about our concept in respect of the disease, I think would be something more informative to promote homeopathy. So that is why I thought to talk on this subject. So diseases are known by names. Nowadays, patients are more known diseases than the physicians sometimes. So in such a situations, it is something very pathetic to say the hidden fact behind the disease is unknown to them. So this topic will make them aware something about what is unknown to them. To begin with, I would like to start with on a general idea about how these things came into existence. Since the time unknown to this very moment, disease, suffering, untimely death have been a major threat for the human existence. This made the man to look out for solutions. Different ideas, views, theories, and ultimately made the man to establish various medical systems. We know every system has its own principles, means and methods in respect of the disease and its cure. Some of these principles may be similar and some are not. In spite of all this effort, unfortunately, still the threat remains unsolved. Today we witness it with our own eyes. I think thus the war against diseases and death has become an ever-continuing process. As I said, today, a large number of medical systems being practiced all over the world. Some of them are well organized, systematized, and taught in medical colleges, and also legally authorized to provide healthcare services. Among them, only very few systems are known to majority of the population. Allopathy, or the conventional system, better known as the Western medicine, is the leading system, well established and practiced all over the world with full authority. The whole health education and the public health care services are based on this system. Whether we like it or not, we have to admit this truth. Therefore, the people are more or less aware something about this system, such as names of the diseases, names of the drugs, certain medical investigations, hygiene, public health, and etc. Now, when we come to homeopathy, we know homeopathy is the latest and most refined medical system practiced in many countries over the past 2 centuries. Today, homeopathy is gaining much recognition and credit for its efficacy and safety of its remedies. I think still its inner core and the true purpose remains unknown. There is something more than the efficacy and safety of remedies that we have to share with. I think the time has come for us to open our treasury and give away its wealth for the well-being of man. This is an initiative step, and trust more and more ideas and information will flow in from eminent homeopaths around the world to nourish the minds of seekers of truth. Let us see what is known as disease. The well-known conventional system of medicine considers the human body as its base to deal with all matters connected to health and disease. Here, the structural, functional, and biochemical changes of the organs or deviation of the pre-decided values of the body constituents are considered as diseases. They are equipped with high-tech instruments to identify these changes. Identifying such changes and attributing a name according to the system and the organs is called diagnosis. Now, once the diagnosis is being made, they are classified as communicable and non-communicable based on their cause and as well as the mode of transmission. Now, we have a bit of confusion. We know the biologist and the medical scientist admit that man is a living being, but they consider only the human body for the scientific and medical investigation and research. If they consider the body as living being, then there cannot be dead bodies or living bodies. But in reality, there are dead bodies as well as alive bodies for the living man. Now we have to sort out the issue. Truly, what makes the body living or dead, which is unknown to the scientists. Hanamanan, the greatest scientist the world have ever seen, solves this problem in a more applicable manner. He says, the material body without vital force is capable of no sensations, no functions, no self-preservation. Now, we know in dead bodies, there is no sensations, there is no any functions, and there is no self-preservation also. If we leave the body in a natural environment, it will decay within hours. So that means the body derives all its sensations and performs all functions of life, as Hanuman says, solely by the means of the immaterial being, the vital force, which animates the body in health and disease. So without the vital force, which is generally called as life, the body has no sensations, no functions, and as well as no self-preservation. Hanuman very clearly defines the material body derives its sensation, functions, and self-preservation from the immaterial spirit-like energy of the vital force. And further he says, in its absence, there is no sensations, functions, and self-preservation. That means it is the vital force which makes the body dead or alive, which it is well known as the life power by the public. Now we'll see what happens when we fall in. In the course of our existence, we experience easy and uneasy, pain and pleasure, joy and sorrow, happy and unhappy, comfortable and uncomfortable. In other words, healthy and unhealthy. We call it ease and dis-ease. Truly, what makes these differences? This is something not spoken much about. Hanuman says, in the healthy condition of man, the spiritual vital force dynamites that animates the material body rules with unbounded sway and retain all parts of the body in admirable, harmonious, vital operations as regard to both sensations and the functions, so that our individually reason-gifted mind can freely employ this living, healthy instrument for the highest purpose of our existence. Now here, healthy means a status in which the mind being freely employing the living body, which performs its function harmoniously and peacefully without any unusual sensations or feelings to achieve the highest purpose of living. Now, this is a very unique dimension. Hanuman is trying to express the highest purpose of living. It is a big challenge in the modern days. How many of us are doing this? Have you ever thought of this? If somebody happens to say yes, it's something good. But I think we are so busy in our day-to-day life. Our purpose of living is unknown to us sometimes. So, Hanuman says, in a healthy living man, it is the vital force or the life power animates the body, dynamizes, animates, and performs the functions of the body in such a manner where we have no any abnormal feelings and sensations, and we freely be free to do things. But do things is not what I said as the highest purpose of highest and something doing for the highest purpose of our existence, and we do something. Here the Hanuman emphasizes a very important factor. Being healthy means living to achieve the highest purpose of living. Do any men on earth do this? Today man has become the greatest threat, not only for the fellow men, but for every life on earth. We can see that it is happening this very moment. So this may be the reason why Hanuman says all the human beings are soaring, or we are all moral lepers. We do not know what we should do, and we do not know what we are doing also. This happens without our knowledge, I think. And it is high time to just think about these ideas and carry this message to the public. Actually, what happens when we fall in? As physicians, when patients come to us, they will narrate all their problems. Some of the complaints what they make cannot be clinically interpreted. We say something like this. A person comes and says, "Doctor, I have a burning feeling in my stomach." And we are free to say it may be due to some hyperacidity. The patient also will agree. Now, an innocent fellow comes and says, "Doctor, I feel my feet are burning like fire." Now, what are you to say? Do we have anything to say about this feeling? The sensations? Why that person is having a burning sensation in his feet? A patient says, "I have a headache. It is pricking. I can't bear it. It is hammering. I can't tolerate it. It is throbbing. I can't sleep." Now, these sensations, the pricking, hammering, throbbing, is there any clinicians on earth who could interpret really what it means, what happens? You can simply say it's a pain, it's something different. But the patient tried to define it in a more particular manner. So that is the feelings, what the patient feels. He do not know what is happening within the brain or whatever, the abdomen or whatever it is. He simply says, "I have a throbbing pain." The Hanuman says, when a person happen to fall ill, it is a spiritual self-acting vital force present in everywhere in the body is primarily deranged by the dynamic influence of the morbid agent inimical to life. So if there is any factor which is inimical to the life, it can be a matter of words. This happens. It no need to be always a material substance. It no need to be a poison. It not to be a germ or whatever it is. Even a little bit of words also can do this. It deranges the vital force. So it happens in a dynamic way. Now the modern scientist says matters makes no matters. So what is going to make matters then? So the energetic level it comes. So the energy means anything in the dynamic form, in the immaterial form, can derange the vital force. That is what Kent says. So this derangement, what happens? Causes abnormal sensation in the body. Quality-wise changes. And it doesn't stop there, and it proceeds further. And this abnormal sensations, Hahnemann says, the disagreeable sensations, and it has an incline to irregular the process which we call diseases. So it doesn't stop at the first level as causing some sort of abnormal sensations in the body, and then something else happens. It goes further. Then the process goes further, and gradually the functional changes, what do you call it, tissue changes, everything happens gradually. So it becomes a continuous process. Now we put it this way: the vital force is an immaterial, invisible energy. It is dynamic in nature. It has no value as in the form of weight or whatever it is. And it operates dynamically. To operate, it needs a medium. So the human body becomes the medium for it to operate. First, it expresses its presence in the form of sensations in the body. Because if there is life, the body will have some sensations. And if there is any defect in the energy, in the vital force, that will modify in the first degree the sensation of the body. And then that modified sensations, Hahnemann calls disagreeable sensations. So these disagreeable sensations are unusual. So those unusual sensations we call disease symptoms. Disease symptom means the person who has been ease and comfort becomes uneasy, uncomfort, or diseased. So he comes out with the sensations what he feels, which had been not there when he was healthy, when he was comfortable. So whatever the feelings the patient expresses, we call it as symptoms or disagreeable sensation what the patient is experiencing. Now here, the derangement of the vital force is the primary stage. On the primary stage, on the onset, it gets deranged. It is something like a process of rain. Now, before the rain falls, the sky becomes cloudy, dark, and we can see the clouds moving fast, and there will be a blowing. We can see the leaves falling from the tree, and certain birds used to fly in the sky. So these are the first signs. In a disease, the sensations what the patient comes out is something like the beginning or the onset. Then what happens? Gradually the rain started to drizzle with, and likewise these derangements will go further, and it has an incline to irregular the vital operations and functions of the organs. So the inner organs will not function properly. The total operation of the body becomes bit irregular, and that is, we call it, the functions of the organs become bit irregular. Now, if we have a means and method to arrest this condition at this level, or if we can, terminate this process at that first level, the other condition, other follow-up problems, the functional changes or whatever the other changes will not come in. If we fail to do that, then what happens? It will continue and cause various other changes in the mind and the body. So this process we call the disease. Whereas in other systems, changes are called as diseases. Whereas in homeopathy, the process we call as disease. That is why I always used to say disease is a process. Hahnemann himself says disease is not a concrete entity. It is a process. So in this process, many things can happen. It starts as a disagreeable sensations. And these disagreeable sensations will be expressed or conveyed by the person who is experiencing it in many ways. It can be in his appearance, behavior, personality, feeling, emotions, sensations, and he may, by words, he may communicate tendency. Infants can't communicate, but still the mother can see that my child is not usual, not healthy. Because the way it cries, the way it sleeps, these changes, the mother will be able to see them. And there is another degree where the mother gets communicated through the child, with the child. So she can feel within her even the small degree of changes in the child. And she says the child is not normal, something wrong with. So this is what happens. So the communication, no need to always verbal. The patient no need to always come and say, I have this. That is what Hahnemann says. Diseases not to be named, but to be perceived. The perception level is something very much peculiar. Only an homeopath can have it. Only he knows. By looking at, he can decide sometimes what he is going to give. So this is the something advantage that we have in homeopathy. Now what happens? The disease process can be modified by many factors. Something like causative factors, sensitiveness of the person, mental situations, environment, circumstances, treatment. So there are many factors. These factors modify the underlying disease process. So accordingly, the symptoms will keep changing. Sometimes when the patient comes and tells all type of symptoms, now we find very difficult to understand whether it is the true disease the patient is having, or this has been modified by the treatment that has been taken. So it has come to that in the present day. So understanding the conditions or the modifications or the changes in a human being, in a patient, is not as it was during Hahnemann's time. So what happens? Let us see the result. Unless we terminate this disease process, now the secondary level changes takes place. That is, first, the functional changes of the body. Now the doctor is able to detect some of these changes in the patient. Not in the first time. The second visit, he will say, I see your heartbeat is high. Some changes he will be able to tell. And those changes, we call it the physiological changes. Heart rate is high, breathing rate is high, pulse level is high, pressure is high, or whatever it is. And then the patient will be referred for some clinical or pathological investigations. And sometimes some pathological changes could be seen now, which we call the pathological changes, means the biological, biochemical changes in the body constituents. And the time gradually passes over. Still the patient will report to the doctor and they say, doctor, no, still I don't feel better with all your treatment. Sometimes he will keep on changing the doctors also. At one stage, the doctor will say, right, we'll go for some other medical investigations, such as X-rays, MRI, this and that, ultrasound. Now they were able to see something solid in the man. They will say, I say, some changes in the body, they can say. Some ulcers, tumors, or some whatever it is. Some structural changes. These structural changes becomes something solid what the doctor has detected in the patient. Now the doctor is happy to say that I know what is happening within your system. The patient also is happy to say that his disease has been identified. But the truth remains somewhere else. The conventional system, they consider these changes as disease. And they assume this is an concrete entity. But only the homeopath says no. It is only the result of the disease. It is neither the cause nor the disease. Now, the disease is not going to end at that level. The patient will be given what type of treatments. While the patient is under the medical care, under the treatment, what happens? The underlying disease process will continue further. And not only continue, they get modified also. Now, Hahnemann says suppression is detrimental to health. Now, how do they suppress? They suppress the symptoms to control the sufferings or whatever it is. To suppress the superficial symptoms, they give various types of medications. While the patient is on these medications, the underlying process continues and gives out some other symptoms. Now we have something else to say. The doctors say, this is a complication. So likewise, the treatment will ever continue until the last breath. Now what we are going to do under homeopathy? This is the challenge what we face. Now in homeopathy we say, homeopathic cure is restoration of health. That means termination of the disease process. That is inhibiting the disease causative factor. Now sometimes I have some experience. One of my patients, who had been under my treatment for nearly about 2 years, was telling me one of her neighbor asked her, it seems, I said, you are taking homeopathy treatment for nearly about 2 years. What way that you are benefited? Something very peculiar questions. The patient told, it seems, this is something you may not accept it. I am not bothered whether I am cured or not. All but I can say is, I am free from all my sufferings. I can attend all my day-to-day work. I have no any cards to carry with me. I don't have any files with all type of laboratory investigations and reports. I go empty hand to my patient doctor. He gives little medicines. I am always happy and free from all my sufferings. So what happens when we terminate the disease with homeopathic medications? There won't be no more complaints from the patients. The patient may not be cured. That is a different issue. We forget it. But here, the termination will stop the further progress of the disease. The patient may visit us only once, may not come again. But with our first prescription, if we happen to do that, that will be a great service. But an homeopathy can do it for a patient. So that is the advantage that we have. What I feel, if we can do this bit, that itself will be a great merit. All credit will go to Hanuman. Unfortunately, if we happen to be another copy of allopaths and limit ourselves for the labeled diseases and the inner expectation of Hanuman will not be carried to the patients, and the masses will not benefit out of homeopathy. So I think to do this, we have many things to do. First, we have to identify the nature of the disease, and we have to classify it, and we have to identify the causative factors, and we have to classify the symptoms and evaluate the symptoms, and we have to select the remedy. And after administration, we have to find out whether there is any obstructions, and we have to remove those things also to achieve the cure that we expect. I think it is a very large subject to discuss about. Just for the information, it is known to all the homeopaths around the world. The derangement of the vital force, which we call as the disease, can be classified into three main groups. The first one, we call it indispositions. That means where the patient feels something abnormal, sick feeling, which we arrest without any medications. Little bit of rest, change of food, a good sleep makes him normal on the following day. That we call it as the indispositions. And there's another type of disease we call the purely surgical. In the modern life, there are a lot of accidents, a lot of injuries, which causes, which needs surgical or the mechanical corrections. The last one, the dynamic disease. The dynamic disease means it happens in the dynamic manner and arises from the life power. Such diseases are classified again into two groups, acute and chronic, according to their nature. We know the acute diseases will have a cause, as well as we can identify the immediate exciting factors. And we will run its course and terminate. The termination means either the patient will be totally cured, or sometimes it will be the end or the death. That means the disease will end either by total recovery or by death. And all these acute diseases may prevail in the society as an epidemic, endemic, sporadic, or pandemic. The COVID is a very acute disease, and it has, as it has been spreading all over the world, we call it pandemic. Anyway, it will run its course and it will stop. We as homeopath know it is going to end one day. And depending on various conditions and various diseases the patients are having, it can be fatal. Otherwise, majority of the people will recover. It is possible. And our homeopathic remedies can help them a lot. When it comes to the chronic disease, we know it will be another menace causing a lifelong suffering. There is no end of it. It is an ever-continuing disease with modified symptoms, either miasmatic or non-miasmatic. This is a very vast subject we can take up in our future programs. And we know what are the miasms which causes disease. And there's another factor which is much important to get to know, that the non-miasmatic factors, such as the lifestyle, the fetal environment,
Dr.
Yeah.
Chandana, can you wind
Yeah.
up within 2 minutes? Your time
Yes,
is
yes. Not even 2 minutes. It will
yeah.
just 1 minute.
Okay.
And so, as I said, these factors also cause a certain amount of chronic diseases. So I think these are not my ideas. I just picked up from the organon and made it little bit of a simple way to make the, especially the layman who joining us to get to know the fundamental principles of homeopathy in respect of the disease. Thank you very much, and over to you now.
Thank you, Dr. Weerasekara from Sri Lanka. Now it is time to ask question and answer open forum. I request the participants to go to the participant list and raise your hand so that we can call you upon the order of raising hands. First, I invite Dr. Sridhara Kurup. Dr. Sridhara Kurup, sir, please.
Thank you, Dr. Chandana Weerasekara. It was a reminder of our organon. Of most of the things were from the organon of medicine. So it is a revision for us. So thank you very much. But what I feel, one more thing is that in the present situation, in some diseases, example, some chronic diseases, we require investigation also. Because to understand the depth of the disease and the prognosis and diagnosis will help to what are the food and what are the precautions we can take, that we must require to the investigations. It is essential. I feel so. This otherwise simply to reduce to the, sometimes to confirm whether what stage the disease is. It depends upon what medicine we can prescribe, what potency, and whether it is high or low or medium, and whether we can repeat the medicine, same medicine. For all this purpose, the investigation is most essential, what I think. That is, I would like to say. Thank you very much.
Thank you.
Okay.
And I totally agree with you. Now, during Hanuman's time, he didn't have even a microscope. Now, we have all high-tech instruments. These things are freely available. We must make use these devices and the facilities available to understand the real background and what is happening within the human body. But what I am trying to say, these are only for our informations. These informations can be used to, as you said, to decide our potency or selection of remedy and how it is pathological. If actually now we have a challenge. Now when we say homeopathy can cure this, this is a question is comes from the other medical systems to ask what way this medicine works. It was one of the questions raised in the our close-up ceremony of this Hanuman Day celebration also, to say how homeopathy remedies acts. So this is something very important. I totally agree with you. I have no any objection for it. When we have these advantages, we must make use, and it will benefit not only the patients and the other system also to admire our services. Thank you very much.